But those are not the realities of the industry. Those aren't the realities of the science. The realities are the science is quite raw. So despite remarkable progress over 20 to 30 years, we're still dealing with human biology, which is extremely complex and still quite poorly understood. Better understood than it was 25 years ago, but we're not talking about an engineered system like semiconductors or computers where we understand those systems because we manipulate those systems. They're human-made systems. Human biology is what it is, and it's proven devilishly difficult. Third is the science is highly interdisciplinary. We make a mistake when we talk about the biotechnology revolution or the life sciences revolution. It's not one, it's many. It's a constellation of technical and scientific revolutions which have been occurring across a very broad range of scientific disciplines. Computer science, biology, chemistry, engineering, physics, those are all part of the puzzle. And it's not a matter of doing any one of those pieces well. It's a matter of how you integrate those. And third, we know the knowledge base is cumulative. We know that the new stuff comes along and is interesting, but there's lots of old things you have to do well in creating a drug. Formulation. And for small molecules, medicinal chemistry, which has been around for 100 years. Those are all part of it. So it's not just a matter of doing the new and keeping and forgetting about the old. It's harder. You have to do the new and the old. Those three realities of the science create three challenges for business models. One is you have to be able to have long-term investment and manage risk over very long periods of time, 15 to 20-year periods. You need a very high degree of integration, and you have to be very good at learning. And if I had to say what are the three design requirements of this industry and of business models, it would be you have to do those three things well. You have to be able to manage risk and investment over long periods, you have to be able to get the integration right, and you have to be able to get learning right. I'm not going to go into this in detail, but if you look at every business model in the industry, they fail along some of these dimensions. And in fact, a lot of the way the biotech industry has evolved has almost guaranteed itself not to be able to solve the problems of long-term investment, integration, and cumulative learning. So a very good example, in the US, firms often try to go public as early as they can. Public equity markets are not the place for companies that need 15 to 20 years to invest before they get a product on the market. Okay, it just runs completely counter. That governance structure of public equity, that business model was never set up for the young biotech company. So what's wrong? What's wrong is, in this picture, is we have penguins on a tropical beach. Industries do well when, like biological species, they're well suited to their environment. And what we have is the design and evolution of business models in the industry have evolved in ways that are completely incongruent, non-adaptive, and not fitting to the realities of the environment that they're in. So let me take a few minutes to suggest some alternative approaches, some innovative models that may or may not work, but at least they're worth discussing. They have to do, again, three things well. You've got to get the long-term financing right, you've got to get the integration right, and you've got to get the cumulative learning right. I want to talk about three models, and I'm not going to go into, there's slides for each of these, but I think in the interest of time, what we should do is I'll talk about these three. The first is what I would call the disposable firm or recyclable firm. When many entrepreneurs start a company, they have a vision that they're going to create the next Genentech or the next Amgen. Okay? The reality is there's very few Genentechs or Amgens or Genzymes. There's only a handful of profitable biotech companies. Only a few companies have made it on their own. There's another thought, which is you can think about developing a drug as a defined project, not unlike the way we think about the development of a movie. And I've spent some of my time studying the movie industry as well. If you think about the way a movie gets developed, a studio brings together a set of contributors, financial contributors, some talent, some directors, some business talent, some special effects crew, some infrastructure. They make a movie, and at the end of the movie, and they actually set up the movie as a limited liability corporation. They make the movie. At the end of the movie, everybody goes home. At the end of the production of the movie receives the payments, depending on how well it does, some residuals, and those are distributed. The talent, the actors and actresses are often paid a residual of the gross. Some others are paid a fixed fee. Special effects crew are paid an amount, etc. But the movie goes away as an entity. The company goes away. That limited liability company has a short life. It's a couple of years, 3 to 5 years. Why not think about a biotechnology company that way, where when it is essentially a project, like a movie, to develop a drug to a certain phase, and then when it reaches a certain point, the firm is acquired. Now, it's not acquired to stay in business or to stay as a running subsidiary. It's acquired solely for the intellectual property. And the assumption is that everybody leaves. There's no attempt to retain the talent. It's just develop the technology, get it in the hands of another company in, say, phase 2 studies, phase 3, and that's it. What's interesting is that model actually is how we do medical devices. An awful lot of medical devices, which are marketed by companies like Johnson & Johnson or Medtronic or some of the other big players, most of the major innovations are developed by startup companies that are then acquired. And there's a whole market for acquisitions that go on. So that's one possible thought. I think it gets rid of the idea of trying to create a model around a company that sustains itself forever. The other reality of biotechnology companies, it's hard to develop your first drug. It's really hard, and you have to be really, really lucky to get your first drug on the market. It turns out to be, it's even harder to get your second drug on the market because you got to do it all over again. And the track record of companies that have developed multiple drugs is very, very small, very small. So even some companies like Amgen, who have several drugs, in fact, they've only put about 4 of their own molecules on the market themselves in their whole life. Very small number. So even for the so-called best, it's been very difficult. And I think a lot of resources get lost and wasted when companies which